Hello everyone, it's Dr. Timothy Smith from StudyMetrix Research again. Continuing our talks about different types of pain conditions and the research behind new treatments for them. Today's topic is rheumatoid arthritis. Rheumatoid arthritis is the most common of the autoimmune disorders. And it's interesting because we call it arthritis, but it's much more than just arthritis. The body's immune system attacks the lining of the joints, are called the synovium, and this becomes inflamed and swells and can erode into the cartilage and the bones themselves. The tendons and ligaments can become loose, and the joints can become destroyed and cause gnarling of the fingers or subluxation or displacement of the joints of the wrists or ankles or other joints. It's very disfiguring and disabling, terribly compromising the quality of life. Also, rheumatoid arthritis can actually affect other tissues in the body, including the skin, the eyes, the heart, lungs, kidneys, and others. And people can have severe consequences from this, such as lung failure, shortness of breath, heart failure, and so on and so forth. It's a terrible condition. Fortunately, there are a lot of biological treatments, we call them, medications that interfere with the body's immune system so that you can turn off some of this inflammation and preserve the joints, and what we call disease-modifying agents. And there are actually some new research projects on non-medication approaches that don't impair the immune system. So this could represent quite a new approach and bring an extra benefit to patients that they might not get from some of the immune system medications. Several other complications can follow besides joint destruction in patients who have rheumatoid arthritis, and they can develop nodules, they can get dry eyes and dry mouth, they can develop carpal tunnel syndrome, heart problems, lung problems we mentioned before, even some cancers can become more prevalent in patients that have rheumatoid arthritis. So it's a painful disorder for sure, but there's a lot more to it. It's very disfiguring, disabling, and dangerous for patients to have, and new treatments are necessary. There's a lot of unmet need. Patients need more ways to cope with this. If you want to know more about some of the things that we're thinking about and working on at StudyMetrix Research, we'd love to hear your story. We'd love to know what you're going through and think about how research might benefit you or others in their community. Our number is 636-387-5100, or check us out on the web at StudyMetrix.com. Thanks. Have a great one.